Gynecology, minimally invasive surgery, which means that we do complex, benign gynecologic cases through anything through laparoscopy or robotics. Minimally invasive gynecology is technically the operations that we do in the operating room, which allows women to get any complex procedures or any major surgeries such as hysterectomies, myomectomies, any pelvic reconstruction, and it's done through minimally invasive fashion where we use very small incisions to accomplish the same thing. We're talking about fibroids today, which is the most common benign tumor of the female pelvis. And up to 50% of women have fibroids by the time that they're 50. But when you look at African American women in particular, they actually have fibroids up to 70 to 75% by the time that they're age 50. That's the million-dollar question of why African Americans or women in general have fibroids. So we know that it's a benign tumor, it's a smooth muscle tumor, but what we don't know is the reason that, one, females get it, but also for African American females, why they seem to have even bigger fibroids or fibroids that cause even more severe symptoms such as bleeding. We don't know what causes the fibroids. We know the architecture of it, what cell line it's from. But when you look at different reasons why someone might be more predisposed to having a condition such as fibroids, it could be genetic. We know that it's very strongly linked to genetic factors, and you'll see that family history has a lot to do with fibroids, but also could be linked to diet, could be linked to specific weight factors. But we don't know that one specific reason why women have fibroids. Anytime we have women that come in with whether it's pelvic pain or a heavy bleeding issue with their cycles, we really do try to hone into their family history. And when we ask them about genetics, we ask them about if their mother, an aunt, a grandmother ever had any issues with heavy bleeding or if they themselves had been diagnosed with fibroid tumors. Yeah, typically when you have fibroids of the uterus, usually what you'll see is the most common symptom would be that heavy bleeding. And that heavy bleeding is what you'll see through the menstrual cycle. And women will usually come in complaining of during their menstrual cycle that they'll actually have heavier bleeding than they may have in the past. Or typically, some women just have heavy bleeding from the time that they start menses. The pain can come with fibroids generally when they grow very big in size. And so when they do grow to a certain size in the pelvis can be somewhat limiting when you think of space. And so fibroids are going to be space occupying, and the larger that they get, the more space that they'll take in the pelvis. And that can manifest any ways when you have pelvic pressure. You can have pain during intercourse, but you can also have fibroids that rest on the bowel, which would cause any issues with bowel movements, and also if they rest on the bladder, which would cause some urinary issues as well. They are confined to the actual uterus tissue, but when they grow with size, that can again grow further into the abdomen just because there's nowhere for them to grow. So they'll grow upwards, they can grow outwards, but they're still confined to the actual uterine tissue. They can get pretty big. I've seen some maybe as small as grape size, but some as large as what we'd call small watermelon size. Fibroids can get really, really large, and that's why women, come in with symptoms such as pain or heavy bleeding, is because these fibroids really can get magnificent in size and significant size. Yeah, fibroids actually can cause issues with fertility. Depending on their size and location, they can either obstruct conception or they can have women who do happen to get pregnant increase risk for miscarriage or even preterm labor or delivery. There's no cancer risk for fibroid tumors, but there are certain growths of the uterus that are cancerous. So those are what we would consider more of the malignant growths of the uterus. But fibroids in general, when they are fibroid tumors, they are benign. They're another growth and another cell line and another tissue of the pelvis and of the uterus, but the fibroid tumors are benign tumors. Fibroid tumors have been known to be around for long amounts of time. We don't know the actual time frame in which we've known about them. But historically, when you look at the literature, they've been known for decades, if not centuries. But when we talk about fibroids, again, we don't know exactly why they're, what causes them to grow or why they grow to such significant size. But what we do focus on is the actual treatment and recommendations for management when women do come in with complaints of fibroids. When they come in with fibroids, again, we'd said that the statistic was 50% of women have them by the time they're 50 years old, and African American women, that increases to 75% of women having fibroids by the time they're 50. So fibroids in general does not necessarily mean that we have to do anything about them. Now, if they don't grow to a significant size or they're not causing any severe symptoms of the ones that we mentioned before with bleeding, then we actually can observe them and watch them because they're not causing any harm or any complications to the woman who has them at that time. When we do try to intervene with fibroids, it's usually because women start to have some type of symptom, whether that's a bleeding symptom, a pressure symptom, anything with fertility. That's when we have to intervene and talk about the treatment and the management with patients. And that management can range anywhere from medical management. If it's a bleeding issue, we can manage actually fibroids with the bleeding by giving them some form of oral contraceptives to decrease that bleeding. We can always use something such as an intrauterine device, which is placed inside the uterus, which is typically a contraceptive, but it minimizes bleeding. So if the woman's complaint is only bleeding, then we can use things such as an IUD. But there are some procedures that we can do, which are small procedures. We can treat the lining of the uterus if it's a bleeding issue as well. But when we do run into the fibroid that's causing a bulk symptom, such as the size is causing an issue, that's when we usually discuss more of the surgical intervention with fibroids. And that can range anywhere from having a myomectomy, which is we actually remove the fibroid tissue from the uterus, but keeping the uterus intact. But there are some actually very minimally invasive techniques, which I love discussing because, again, the woman does not have to have a lot of downtime when she has these procedures, and the recovery is much quicker. They are done in the operating room. They're done on a same-day basis. And some of those procedures include a hysterectomic myomectomy, which is when we retrieve fibroids from the actual endometrial cavity of the uterus. And then we also have a novel technique, which is newer, and that's a laparoscopic radiofrequency ablation of the fibroids. And what that does is we approach the fibroids in a laparoscopic fashion, and we actually take the device and we insert the device into the fibroids under ultrasound guidance that's done at the time of the procedure and the operation. And what that energy does is it allows it to denature the actual fibroid and makeup of the tumor, allowing it to shrink in size. And that can help a woman when we decrease the size of the fibroid. Hysterectomies are actually another, so now that kind of works out of the minimally invasive, that's more definitive. So when a woman comes in and she has symptoms from fibroids, whether it's bleeding or just the bulk symptoms of a fibroid, and she's like, I don't want to keep my uterus. A hysterectomy is actually removal of the uterus along with the fibroids that's composed within the uterus. Now, hysterectomies are actually definitive, meaning that that's the gold standard of decreasing the issue with the bleeding and the mass, because we actually take the actual organ out, and therefore the woman wouldn't have any issues with bleeding or any bulk symptoms. But she wouldn't have any uterus left, and therefore she wouldn't have that capability or the ability to conceive in the future. Hysterectomies actually are probably the second most common gynecologic surgery after cesarean sections, and up to 600,000 hysterectomies are done a year. And most of those are done due to a bleeding issue or a fibroid issue. Historically, when you look at hysterectomy as a procedure, that used to be really the only option for women who had these issues. So as we progressed throughout technology and medicine, we do know that there are other options, such as we've mentioned, but hysterectomy pretty much still remains done very often and most commonly done for those reasons. Yeah, women who have conceived and maybe are finished with childbearing, sometimes in their journey, they're really done with the other options that are offered because, again, it's not definitive. So it's not necessarily, those other options are not taking out the organ, and therefore they wouldn't have that issue in the future. Right. So they're really eliminating any possibility of having a bleeding issue, any recurrence of fibroids in the future by getting rid of the actual uterus and the fibroid tissue. What it does is it actually affects just the fibroid tissue without affecting the uterine tissue outside of the fibroid. And what it does through the radiofrequency ablation technique is it actually delivers that radiofrequency energy to just the fibroid tissue, therefore allowing the fibroid tissue to decrease in size and therefore shrink by 40% in volume. Radiofrequency energy is not anything radioactive. It's rather an energy that's delivered to the actual fibroid and allows it through heat to decrease in size. And it denatures the actual tissue in the fibroid, therefore, it not allowing it to grow any further. And therefore, that's why you'll see that shrinkage. It was approved by the FDA in 2012. It's actually being used in various states. One of the reasons that we see that radiofrequency ablation is not being used maybe as much as a hysterectomy is one, widespread knowledge of the actual technology, but also insurance. So when you look at insurance carriers, they again will decide what procedures are approved and what aren't. And so what you'll find is that there are some women who live in certain states where their insurance carriers do not cover that actual procedure versus women who are in states that their insurance will cover that procedure. From someone who does minimally invasive surgery, I think absolutely. When you look at the actual procedure, it's done the same day. Women get to leave the same day. Their recovery is as as short as a week. And so when women really think about, one, the ability to conceive in the future, so they want to maintain having their uterus, also downtime, women want to go back to their careers, taking care of their family and children. And so recovery kind of inputs how much they're able to devote to those things after surgery. And so with this type of procedure, what it allows women to do is address their fibroid situation, decrease their bleeding, decrease the size of the fibroid, and allow them to resume their daily activities and improve their quality of life. Fibroid tumors have been here, as we know, for decades, possibly even centuries. And so when we look at what's been offered for fibroid treatment, there have really not been that many options. Some women are not really ready to have a hysterectomy. It may be recommended to them, but that's not really what they want to do. And so when you look at science and technology and what we're able to offer women in a minimally invasive fashion and allowing them to resume their normal activity in a short amount of time, I think technology-wise, this is something that should be offered nationally. I think all women should be given all the options of fibroid treatment and not just some variation of a list depending on where they live or what type of insurance they have. And so I find that this is a procedure that could be applicable to all women, to all different varieties of fibroids, and allow them to decide if a minimally invasive approach is the way that they want to go. Absolutely a breakthrough when we think of fibroid treatment and management. Many times that there are women who do medical management and they fail that management, and then they're only offered the most definitive, which would be the hysterectomy. So when you look at alternatives and women who don't necessarily want a hysterectomy, I think that this is a major breakthrough for fibroid treatment and a surgical approach that allows women to resume their daily activity and quality of life. If we were to think about things that might be limitations to the procedure, one, it is an actual surgery, has to be done in the operating room. Some women are not, maybe wanting to do that approach and would prefer to do a medical management. So that's something, when you talk about the journey of fibroids and what women are offered, some women are not necessarily ready to do a surgical approach, whether it's minimally invasive or not. I think another limiting factor could be, again, the insurance. Women who do want the actual procedure but are not able to do it, that actually can be something that is, for a woman, that is not optimal. It is approved all over the country. It depends what state you're in. Texas is actually one of those states where it is approved by certain insurance carriers. And so you'll find that Texas does have probably more women that it's being approved and done on than other parts of the country, absolutely. I think because I have focused on this technology and the fact that I have done it in this state and other states as well, I feel that this is an option that I offer to my women all the time because one, I'm able to provide it, but two, that I know about the technology. So I think that there is a portion of education and awareness both to providers and to women to know about this technology that would improve and increase the knowledge of this actual procedure. I think that women are very satisfied with the procedure, the fact that the downtime is very minimal, the fact that they're seeing decrease in their bleeding. And for women who do have a bulk symptom or a pressure symptom with their fibroids, that they're seeing reduction in that fibroid size and therefore that they're having great outcomes. Oh yeah, I think this is groundbreaking. I feel that the trajectory of how we look at fibroids and how we're able to treat them could be possibly changed by this procedure and technology itself, because it will allow us to even go further in fibroid treatment, because we're able to do something that is so novel and different to what we've done in the past, that only going to be able to get better with our treatment and management of fibroids.